The recent heat wave that hit British Columbia in late June and early July was a disaster for the health and well-being of people and animals, especially those who are vulnerable or marginalized. The extreme and unprecedented temperatures, reaching up to 49.6 degrees Celsius, caused hundreds of deaths, many hospitalizations, and widespread suffering across the province. Heat waves are the leading weather-related cause of death in Canada, and they can also worsen mental health conditions such as depression, anxiety, and bipolar disorder. Heat waves can also affect the health of animals, such as pets, livestock, and wildlife, by causing dehydration, heat stress, and heat stroke. People with disabilities and older people are at high risk of heat-related illnesses, but they were left to cope with the dangerous heat on their own. Many of them live in homes without air conditioning or adequate ventilation, and face barriers to accessing cooling centers or other public services. Some of them also rely on medications or medical devices that can be affected by high temperatures. The provincial government failed to protect these at-risk populations by not having a heat action plan or a coordinated response to the heat wave. The healthcare system was overwhelmed by the surge of calls and visits from people suffering from the heat, and some patients had to wait for hours or days to receive care. The emergency services were also stretched thin by the high demand and the challenging working conditions. Some authorities and communities tried to respond to the crisis by opening cooling centers, distributing water bottles, checking on vulnerable residents, and issuing public health alerts. However, these measures were often insufficient, inconsistent, or inaccessible for many people who needed them. Some people also faced discrimination or stigma when trying to access cooling services or shelters. The heat wave was a wake-up call for British Columbia to prepare for the impacts of climate change on human and animal health. The province needs to develop a comprehensive heat action plan that includes measures such as providing adequate cooling and ventilation for homes and buildings, improving access to cooling centers and other public services for vulnerable populations, enhancing communication and coordination among different levels of government and agencies, increasing awareness and education about the risks and symptoms of heat-related illnesses, supporting research and monitoring on the health effects of heat waves. The heat wave was a tragedy that could have been prevented or mitigated if the province had taken action sooner. We owe it to those who suffered or died to learn from this experience and to prevent it from happening again.